Everybody, this is Kim Zocker. I'm the Chief Executive Officer at Comprehensive Life Resources here in Tacoma, and I'm here today to introduce you to two women who are working on a really special project for all of us here in the community. Let me introduce Andrea McKinney. Andrea is a substance use treatment professional and a member of the Mobile Community Integration Response Team at Comprehensive Life Resources. And Sherwanda Beck-Atkinson is a veteran and a licensed practical nurse. These two women have just completed their master's degrees in public administration here at Evergreen College and are getting ready to kick off a new project. So thanks for being with me today, both of you.
Hi.
And tell me a little bit about Msaada. How about the name? Why don't we start with the name? Your project's called Msaada. How'd you come up with that name?
So the word Msaada is derived from a Swahili language, and in Swahili it means support. So we figured that's what we're trying to provide, so it would be a good name to start with.
Sounds good, and actually, that's a bit of a spoiler alert. This program has something to do with support. So tell me about Msaada. Tell me about the project that you guys are kicking off.
So the project that we're working on is a pilot project that we came up with in our capstone. That's one of the qualifications for graduation, is that you come up with a community program or something that you can put out into the community that will do work. It has to be a deliverable. So we developed this program. It is for Black and brown women and children, mental and behavioral health support.
And one of your sponsors was Coordinated Care. So you guys wrote a grant to Coordinated Care, which is one of the managed care organizations here in Pierce County that provides Medicaid services. Why do you think that they chose your project to fund? What do you think was their interest in their perspective?
I think we were really direct with what we wanted and what we needed, and exactly what we wanted spoke to exactly what they were looking for.
So what do you want? What are you hoping for out of this project?
We just want the support that this community or this population needs, and that's it. We just want support, equitable support. That's what we would like.
One of the things that Andrea and I talk about with our comprehensive team is that we know we don't do a very good job of providing culturally competent services always, especially for Black women, but really lots of different ethnicities and races. And it seems like in talking to you guys, you're hoping to do that. This project can be a foundation for a program that is really built for Black and brown women to really meet their unique needs. Can you tell me more about what some of those needs are and some of the ways that this program would approach things differently for that community?
So the key, I think, would be the cultural responsiveness of the program, providing a space that is inclusive. It speaks to them from the time that they walk in, from the messaging on the wall to the pictures on the wall to the colors that's chosen, not so much a sterile environment that looks like they've been incarcerated. I think that's a hard place to develop a therapeutic relationship, especially when that seems to have been your whole life and you have negative connotations attached with that. Another place that we hope to be supportive in is that having a provider that looks like you. A lot of places you walk in, it's hard to make that connection from the time you walk in. If you walk in and no one looks like you, it's like, well, I'm coming here to get services, but can you even identify with me? So meeting with a provider that doesn't have any type of background that can relate to you, it's like you're re-traumatized and having to tell your story over again, including context for what you mean by what you say before you even get to the space where you can be vulnerable and get some therapeutic support. So
that makes so much sense to me, that you're really looking at this from a holistic perspective of how do we, from the moment you come into our space, feel that this is a space for you. You belong, it's built for you. How do you communicate in really nonverbal ways that you're going to be listened and understood here? And it sounds like that's really important to you guys. And then you want a provider team that has some lived experience that's similar, that has some background that can feel familiar.
Absolutely. I think that alone speaks to the level of engagement and the retention rates. People won't come back if they don't feel comfortable.
Yeah.
They'll come as it's required, and
Yeah.
then it kind of sloughs off.
Yep.
I'm not saying that happens every time, because there are instances where people would prefer to speak to somebody outside
Sure.
of their race, but for the most part, we're finding that the community's ready to have providers that look like themselves, and they're having trouble doing it based on the statistics that we found in the research.
Right, so just, with doing the research for our capstone, we just found that there was a better turnout rate when there was that cultural competency.
Oh,
And
so
so,
great.
it's not like we just pulled this out of our hat.
Right,
We actually did the research and we found that, hey, you know, the outcomes are higher, people participated more.
Yeah.
So, and just looking at the statistics like Andrea mentioned, you know, psychology is like over 80% white women. So it's great that, you know, we have women,
Yeah.
but what about the diversity of
Yeah.
the women? And so that part is missing. So we just want to make sure it's more inclusive and to make sure we can focus on meeting people's needs. So
That's great.
we just feel that.
And the part of Msaada is really a communication, is a conversation with the community, right? So you're starting with this assessment. Can you,
Because this is where all of you guys come in.
so can you talk to everyone about what you're hoping for and how you're gonna get information that builds on the research, your own personal life experiences, your experiences as healthcare professionals, and how this kind of will come together. So talk us through the assessment.
Absolutely. So part of what our deliverable was, even for our capstone one, was the grant writing, where we connected with coordinated care.
1 for 1. Broke first grant, got first grant funded. That will not be a lifetime experience, but I knew you were going to get it. So anyway, so you're 1 for 1 already.
And then the other deliverable was the creation of a survey and a working service model.
Okay.
A service model that would, of course, be transformed by the inclusion of the community's voice.
Right.
So many times a program is put into a community, but no one asks the community what they need.
Yep.
How will this work for you? What design, what structure, what services? What do you want? What do you need? And this is where the surveys come in. We had put together about 10 questions that we feel will provide us the information that we need to inform the structure and the services of the program. And that's very important if you want to keep people engaged and have them get the support that they need, starting with the people. So it's for us, by us. If
That's
you
great.
design it, then you have a buy-in. You have a reason to go, like, this
Yeah.
is for me, I helped design this.
That's pretty great.
I think co-creation is something that doesn't happen enough in healthcare for sure. We do a lot to you. We hardly ever ask for what you actually would like from us. So how can people participate in the survey? Will this be starting to be shared out in the community as things go along? Where could they look for it? I mean, we would have it on our website for sure at Conference of Life Resources, but I know you guys have talked to other partners and want to try to get this out into the community.
So we have collaborated with some community people that are already known, like the Urban League, the Black Collective has offered their support in disseminating the survey. Now the Pierce County Health Department has also, they have a project where they help Black and brown women and children already, and they have offered their support in disseminating the survey also.
That's great.
So, and then we'll be handing them out because we want to make sure that the access is equitable. We know that
Yeah.
everyone doesn't have the access to, mobile phones
Yep.
or computers and laptops. So we want to have a paper copy that we can hand out to people.
That's great.
We'll also have, what are those, QR codes?
Oh,
yeah. Those are
Yeah.
great.
QRS code
Yeah.
cards, so that we can pass those out to people in
Right.
passing. I mean, there's so many spaces that you might be in the grocery store and see somebody that, hey, hand a handful to them.
That's great.
See if we can get as much feedback as possible in the next couple of months.
Okay. So look at the nearest grocery store.
Yeah.
Anyway, health partners, other lots of healthcare partners are involved in this, and so you'll be seeing this survey out in the world we would love for you to give your input if you are part of the BIPOC community and you're interested in either for yourself, your loved ones, or your community, what we could do in what the Msaada program could do for you and what you think is missing in the services that exist. I think there's an opportunity to do something really exciting here. So right now we're focused on you guys getting as much information as you can, starting that community conversation.
Absolutely.
And then our goal really is to have these two really take all that information, right? And Sherwanda and Andrea will kind of do some analysis of that, really look at that against some of the research that they've already done, understanding best practice and like kind of how we could do better in developing and designing a community-oriented mental health program for Black and brown women and children. And then our goal is to fund this baby and build this program so that we can really build this resource in the community. There's not nearly enough services that are really community-led, and certainly there is a massive amount of disparity and kind of racism in our current system that is probably best dealt with by building a program exactly for the people who are wanting to be served by it and work in it.
Absolutely.
So it's pretty exciting.
Anything else you guys want to have people know about Msaada?
I just want everyone to know that we are partnering with Legally Black, and we are also partnering with Black Men Awareness Walk, Mental Health Awareness Walk in Seattle. So we are partnering with organizations that are already in existence. So you should see us around August, September timeframe with our surveys in
great.
hand. So
Awesome.
we're
Yeah.
there.
All right.
Not like probably July,
Okay.
June, July, like now through.
Well, you know
through
what?
August.
One thing I know about these guys is as soon as they can make it happen, they will make it happen. But anyway, we're really excited. Thanks for joining us today, and I look forward to talking to you guys next time. Maybe when the survey's out.
Yes, that'll be awesome.
We'll talk again and give you a little more information, but we wanted to get you guys at least all excited about what's coming.